this morning we're talking about a very special program based in Hickory, and here to tell us more today is Dr. Corey Richardson. First off, thanks for being here today.
Thank you for having me.
Of course. So first off, just tell me a little bit about the main focus for you guys at ICGH treatment centers.
We're primarily an addiction treatment provider, community health provider, so it's addiction as well as behavioral health services. And we provide every level of care along, partial hospitalization, intensive outpatient. But we have a recovery-focused approach, which is a little bit different than a lot of other agencies. And it's an integrated model, so it includes medication, counseling, peer support, as well as like housing, transportation, and other interventions like employment and education.
Let's talk a little bit more about the housing that you mentioned there, because I know that you said that you offer free housing for people battling addiction.
Absolutely. While we take insurance at all of our treatment centers, we also have free transitional housing through state funding and grant funded. So what we do is we provide free housing for somebody that's struggling, and they get free medication like a Suboxone and free counseling, free peer support, even transportation to recovery-focused appointments.
That is so incredible and very helpful for people going through that to make that process so easy. So I'm sure that's a part of what makes you different, but what all makes you guys so different than other centers?
Well, one of the things I'm most proud of is that we do go out into the rising number of those people that we used to call homeless. Now we generally call it unsheltered. We go out into the community and we help with our peer support specialists who have been through that situation themselves. We bring some supplies, socks and underwear, and really even harm reduction like rescue Narcan. But the most important part is having a conversation and telling people, if you're tired about being under this bridge or you're tired of living out here under a tarp, we can place you in housing today, free housing with a peer support specialist, free medication and free counseling, all funded by state and the federal grant, and help start turning their lives around.
Right, and we just saw those pictures come up as well of you guys doing that. I think
Wonderful.
That's incredible. And I want to talk a little bit more about some of the misconceptions that people might think, especially about using medication with addiction.
That's right. So a company like ours isn't a dose and go, take some medication and go. Medication is to stabilize people so that they don't have craving, they don't have withdrawal. If they accidentally use, it would block the effects of that. But it's a very small part of the real drug-free coping skills that they learn, as well as the recovery environment through housing. And that's, they don't have to go to Malibu. They can come to one of our housing programs, our recovery homes. And then, do you need education? Do you need employment skills? Do you just need some counseling around trauma if you had some trauma early in life? And that's where you create that whole person approach and then titrate off medicine so they don't have to be on this kind of medication, serious medication, the rest of their lives.
Well, I know you guys have 5 centers across the area, so let's talk about where those are located.
So we do have 5 treatment centers from Statesville, Gastonia, all the way down to Shelby, also Lincoln and Hickory. But through telemedicine now, we provide care in Charlotte and across North Carolina. We also provide community intervention. So we partner with city and county executives to provide inside of counties the prevention services, training services. I teach at Northwest AHEC, and we've been able to provide provider education through Northwest AHEC for free. All these services are for free.
Amazing. Well, the number to call was just up on your screen, 828-322-5915. Thank you so much for being here and sharing this information with us today.
Appreciate it.